not only, is my mental health affected by living with a chronic illness that has a lot of pain where I miss out on so much. And, you just sit there and say, oh no, I can't go to that event. I can't go to the birthday, or I can't do this because I'm in so much pain, but you don't want to tell somebody that because you don't want someone to feel sorry for you. You don't want to tell work because you don't want to be treated different. I think that just puts so much on you that it's really hard to handle. My name is Kristen, and I live in Virginia. I have Crohn's disease, and I've been living with it since I was 12 years old. Living with Crohn's challenges me every single day, especially being diagnosed at such a young age. You don't even know how to process information like that. I'd say it gets easier, but some days I would say it doesn't. It's a debilitating chronic illness that causes a lot of pain, discomfort, and you kind of feel like you lose out on a lot in life. But I actually was just talking about this yesterday. It also has given me the best gifts, the gift of strength, the gift of patience. I look at the world differently. I look at different people differently. And it gave me a community that I don't know if I would have gotten if I didn't have a chronic illness. So I make the most of it. So I was very competitive. I loved all sports. I'd play tetherball in grade school, and then I started to play soccer and softball competitively. So I think I just started to not feel good. I was having stomach pain. One of the biggest trackers for us was me seeing blood in my stool. My mom was like, no, absolutely not. Let's go to the doctor. But I just started to not want to do much anymore. I always wanted to, go outside and play. And I was like, I don't want to do that. And I felt isolated. I didn't really hang out with friends or do much outside of school. So I think I already started to feel lonely, but as a kid, you don't realize that. I do remember both of my parents being there for me through it all. Mom was the primary one that was taking me to all the doctor's appointments, going through all of the diets and all of, every treatment we tried. Now I realize a lot of people were talking about, oh, I did this in high school. I did this in, elementary or middle school. And I was like, I never did any of that. It almost made me unaware of what people were doing. Like kids were like, oh yeah, I had a boyfriend. I was intimate, or I did this. And I was like, yeah, very just kind of in my bubble, not knowing what I was missing out on. So I don't think I was as sad or frustrated or angry or depressed. I think I was just so focused on going to school and then coming home and not, you know, feeling awful all day. I significantly, I would say, deteriorated. You could just see my body going through side effects and trying whatever treatment I could to, heal what was going on inside of my intestines and everything. And everything just kept failing. And I kept getting more and more sick. So going from doctor to doctor is exhausting. It's almost like you don't want to try anymore because they keep disappointing you and there's nothing really you could do. You're out of control. Having Crohn's, you do not have control of your body. And I think you try to control it with other things. When I went to college, I was like, okay, I'll try this one more doctor. My uncle recommended her. They both do research for Crohn's. So she looks at me and she's like, you're going to need an ostomy. And it was very blunt. It was, she was direct. And I was like, what? Of course, I was in no position to say no. At that point, my body was just done. I couldn't do much of anything. I was pushing it to go to school. I was pushing it every day, but looking at me, looking at the photos, it just makes me want to cry. The next day, I go into surgery for ostomy surgery. I don't prepare, I don't research. It's a blur looking back. And she says, you want this surgeon, this surgeon, this one's very well known. This one's not so much. I take the well known one. He's one of the best surgeons in the country, and he takes care of me and he saves my life. That appointment and that particular person changed my entire life. I look back at that appointment and I could just see how she was talking to me. I felt that she was going to take care of me. For the first time, I met a doctor that I knew would do anything to, make me continue to live, and take care of me. And to this day, she's one of the most significant people in my life. I went to New York and my mom's like, you got to visit her because she moved over to Mount Sinai in New York. And yeah, it's crazy how just one person in the healthcare system, whether it's a nurse, a doctor, a surgeon, how they speak to you, how they treat you, how they put you through a surgery, that saves your life, what it means to you. And she holds a special place in my heart. And even, yeah, just thinking about that appointment, I knew I was going to, be safe in her hands. I was experiencing significant joint pain, body hurt everywhere, severe, severe abdominal pain, using the bathroom maybe 20 times plus. And when I was in the bathroom, it wasn't like, oh, it goes right through me, I'm out. I would be in there pushing and crying, and sometimes pushing so hard I would have to throw up. I had perianal disease, which means a big open wound on your bottom area. So every time you did go to the bathroom, you were it felt like acid burning you. I had mouth sores, just, I feel like pain everywhere. I couldn't eat much because of the pain. So hungry, dehydration, just every symptom that Crohn's had, but 10 times worse than it should be. Well, I was not lucky enough to have nurses that knew about an ostomy. So when I first woke up, I went home with little to no knowledge of having one. I woke up and I was like, I don't know what I'm going to do with this. I'm only in the hospital for a few days. I go home with my mom and we're like, okay, let's figure this out. My Nana did have an ostomy, but she never spoke about it. I never saw it. I didn't know about it. So she was there as help for a little bit of a resource, but she was very, very ill at that time. So it wasn't like, oh, I have someone that is going to show me everything. So I had home health nurses coming and they would show up and they're like, oh, I've actually never changed a bag. So what that did to me and my mental health, that made me feel even more like I'm weird, or like, not even a nurse can help me. So I decided to figure it out on my own. I did all of the research I could. My mom and I, navigated through it all, found supplies that worked for me. And I, got through college, got through the other surgeries. And yeah, I really had to figure it out on my own. It was very difficult. Up until my first few surgeries, I'd be in the hospital, and not saying you should ever go against, medical advice, but if someone's bringing in 10 pills and you don't know what they are, it's okay to ask, hey, I'm wondering why I'm prescribed for these. I'd like to know what they are. And if for some reason you don't want to take the 10 vitamins and the 3 antibiotics and the prednisone and all of these things, you do have a right to speak up and say, hey, I'd love to talk to my doctor about that. Or if someone is not treating you well in the hospital and you say, hey, can I actually see the charge nurse? I don't appreciate how you're speaking to me, or I'm in pain and you're not giving me pain meds. I'd love to communicate why I need those. And before, I would just not speak up at all. I would sit there and do whatever I was told, and it was really, really hard. And once I learned that I could speak up because it is my body, I am paying for the treatment and I'm in control of what happens to my body, changed my entire journey. The first ostomy was completely temporary. We were going to see if it was going to do much. We're like, let's give your colon a break. Let's make sure that, we can do anything we can to like revive it. When the total colectomy came into play, we had realized there was nothing that we could do to fix the colon. Absolutely nothing. And to leave something that diseased inside me, along with the rectum and just every organ at that point, would have just caused even more to me. So we've decided to take it all out, make it permanent. And that decision did not sit well with me. I was never told this would ever be permanent. I signed up for a temporary ostomy. My surgeon continued to tell me it is temporary. If you do what I say, we will reverse it and everything will go back to normal. Don't ever tell a patient that. I think that really, really affected my journey. So came back, told me I needed it. again, I didn't say, no, we're not doing this, and, try to refuse that, because I knew I was in good hands. This doctor would not let something, bad happen to me, or make a decision that could cause something bad to happen to me. So I had that total colectomy, and it was the hardest surgery and the worst pain of my life. But yes, it did amazing like wonders for my body, removing something that sickly and diseased. It gave me a chance to actually start getting close to remission. I wasn't going to hit remission in my entire life if I kept that colon, or didn't get an ostomy. And I think I knew that even at a young age. I think even 21, you're still kind of figuring it out, not super aware. But I made that decision, and that is when I was starting to get close to remission, in addition to another medication. I think I realized that I could sit there and hate my body for the rest of my life and feel sorry for it, or feel like I was never going to be wanted or looked at differently. Or I could use a different, pathway and find the goodness in my body, the strength and everything it went through. If it weren't for how strong my body was, I wouldn't be here today. So I knew I wasn't the only person out there with this type of body, or these surgeries, or this diagnosis. So did some research, started my brand, started, sharing about my story, in hopes that I could help other people out there. And I think my goal was to help them, but I didn't want to realize that I needed help. I was like, you know what, this isn't for me. I'm going to do it for help, to help them. But then later, being so positive about my body and my story, in turn, they're one of the best support systems that I've ever had. When I was young, it didn't really affect me too much mentally. I've always struggled with anxiety, which a lot of people have, but in my family, it's just been passed down. And with being that sick, I think it also heightens that side of your mental health. So the anxiety of everything just is upstreamed. But when I went into my Barbie butt surgery, we call it a Barbie butt because they sew your bottom shut. I developed medical PTSD from being in a room that no one would be able to see me. It was very, very traumatic. And from there on, that incident has greatly affected my mental health. Not only, is my mental health affected by living with a chronic illness that has a lot of pain, where I miss out on so much. And, you just sit there and say, oh no, I can't go to that event. I can't go to the birthday, or I can't do this because I'm in so much pain. But you don't want to tell somebody that, because you don't want someone to feel sorry for you. You don't want to tell work because you don't want to be treated different. I think that just puts so much on you that it's really hard to handle. And then you add in PTSD. So that means when you go to medical facilities, or you need another surgery, or you have an ER visit, you can't be alone for that. So then realizing you can't even step in an ER if you have an emergency without somebody. So then again, you have no control. You need somebody else to be there to be able to save you. I've graduated college. I have held like 4 full-time jobs. I've been able to travel the world. I just went to Spain and Paris, and I was able to do things like that. I love paddleboarding. I love rollerblading. I can still do everything that a person can do, even with my ostomy. I think it just takes a lot of positivity, which is probably one of the hardest things to do when you're in pain, and just feeling so isolated and alone all the time. Even when you have support from family and friends in an online community, you still feel alone. But with me, I think going on walks, funny enough, a walk helps me. Going on walks in the sunshine help me get through a lot of my days. I have phone calls with friends, I have phone calls with mom, and that support system also helps me get through it. And my boyfriend, having a support system, having a partner who completely understands and doesn't see you as this poor person with a chronic illness that's in pain all the time, that tells you that, you need to stop complaining. That helps me get through my day. I think the stigma around ostomy bags is rooted from lack of education. So I think when people see one online or they think about one, they think about, oh, someone who's 80 has one, they're disgusting and they smell all the time. And not a lot of people have them. Those I feel like are the three biggest stigmas around ostomies. My take on it is to make it normal. This is something that I wake up and I change. I empty it just like you go to the bathroom. It doesn't smell. You see all of the clothes I wear on social media, they're all the clothes that you wear. It's a completely normal thing, and it's just an alternative to go to the bathroom. I kind of use the words to make them sound completely normal. I am not extra about it. Before, when I shared my bag, even to partners, I'm like, yes, I have to tell you something. And then it would just make them so worked up, and then they would be so freaked out. And they're like, what is she trying to tell me? I just make it completely normal. I make it fun. If someone comments something, bad on my post, I'm saying, hey, I I think it'd be a positive thing for you to look at my page. Maybe you can learn something. I'm never too offensive. Sometimes some people can be mean, but I just use it as another way to educate. And most of the time, their response or they don't respond at all. And I think they kind of start to think about, commenting on a disabled content creators, social media is something mean. They're like, oh, maybe this is something that I should be educated on. But breaking stigmas are hard, but I've tried to kind of dive into all of the platforms, and I think I've reached many people. And I hope I've, changed their opinion on an ostomy bag. I think definitely the products that I use. A lot of them want to know the exact like bags or rings, bag changes in general. Like I said, lack of education. They probably were not taught how to change the bag. So a lot of the bag changes or when my stoma is out do the best because people do want to be, educated on how that works. I do get some intimacy questions. A lot of them will go on my messages because people don't, want that private stuff out there. So I do, that's a lot of the questions that I get. Like, can you still do that? Like, how does it work? I recently posted about like how my bag folds in half for like intimate reasons. Showering is also a very, very common one. Can I go in the shower? Is it going to come off? Some of them were patients were taking their bags completely off every single shower, and insurance doesn't allow, that many bags. So I think showering is like a top question as well. So I am somebody who does not use a lot of product. I always say less is more. But when you first have an ostomy, it's, a lot different. You want to have all the supplies just to learn about it. A barrier wipe to just completely go around the wafer to take the bag off is the best on your skin, especially right after surgery. There's a spray or a wipe, and get the ones that don't burn. So you take the bag off. I use dog bags because it protects the odor. So I would always recommend them getting like rolls of dog bags from Target or Amazon. Clean the area around your stoma. There are also wipes for that. I personally use water and tissue because you don't need to sanitize. A lot of people think that a stoma is going to get infected, but it's not an open wound. It's not going to get infected. Like my hands are clean. I don't need to wear gloves. I use a barrier ring. So I mold and stretch the barrier ring out. I put it on my skin to heat it up because it's heat activated. And I place it around the stoma, making sure it's snug, there's no gaps. That is going to help prevent leakage. And then I have a cut. I have to cut my barrier. So I cut the little oval in there. I cannot have pre-cut because it is not a circle. So having pre-cut is helpful. I just peel back the backside of it and I place it around the stoma. I do make sure that I angle the bag because as a female, I empty my bag in between my legs. So I want to make sure that it's angled. And then I put odor eliminator in there. So I just squeeze a couple of drops and then I fold it up and I'm good to go. I think it would be don't lose hope. I think one of the biggest things, if you're sitting there in pain and you're not hitting remission and you're just having surgery after surgery, you don't have answers, you don't have a diagnosis. The one thing that I found, aside from positivity and support and all of those things, I didn't lose hope. Even on the worst days when I developed PTSD and I was in that room It was a recovery place. I needed the hope to get me out of there. If I lost it, I would be deep in depression. I wouldn't have the fight in me anymore. Make sure you have that hope, just a very small sliver every single day, because that will help you get through.